Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. An interesting situation has arisen that many doctors are facing who do physical examinations, primary care, and that is whether or not a chaperone has to be present for any examination of what are referred to often as sensitive areas, breasts, genitalia, the perianal area. In some institutions, there has been a movement towards saying a chaperone must be present. It's mandatory. I know that is true at Yale's healthcare centers and clinics. Others do so when the patient requests it. And an interesting situation sometimes occurs. The hospital or the clinic says, we have to have a chaperone. And the patient says, I don't want a chaperone. I want my privacy. I want the gynecologist or the urologist only. I don't want anyone else to be seeing me. And I'm not comfortable with anyone other than the doctor in the room. Complicating this issue of when is a chaperone appropriate, when can it be refused, if ever, is the fact that the role of chaperone is ill-defined. For example, there isn't really agreement on who can be a chaperone. Could it be a med student? Could it be a nurse? Could it be another doctor? Should it be someone who at least has finished nursing school or medical school? Can it be a patient representative? There are no standards about who can play the role. Should the chaperone be available to be seen when they're in the room? Should they stay behind a curtain or somewhere where they're not, so to speak, intrusive into what's going on in the exam room? Do they sit in a chair? Do they stand? How do they behave, if you will? No agreement. And there's still no agreement on the training that a chaperone should have. Do we charge them with trying to represent what's going on with the patient, trying to protect the doctor against any accusations that are ill-founded about inappropriate conduct? Are they supposed to do both? How do they obtain consent, if they do, from the patient undergoing an examination in a sensitive part of their body or one that they're sensitive about? So this area really requires some hard thinking if you're thinking about having chaperones present. I think there are some online courses that offer some training. I haven't looked at them, but they might be worth a look to see if they make you more comfortable about getting a chaperone oriented. I think it's probably important to set a policy saying a chaperone must always be present for these kinds of examinations and list them, or one can be requested no matter what is going on in terms of the kind of exam being conducted. There needs to be some statement about you have permission to either accept them or refuse them, or you don't. Should they always be present, for example, with patients who are minors and adolescents or children? Does that extend that far out where a guardian, parent, someone has to give permission? So this area, I think we can all understand why chaperones have come to the fore. Allegations of misconduct, allegations of inappropriate touching, comfort levels of patients wanting to just feel like they're more at ease. But it's obvious that we haven't really, as a nation or as medical profession, thought it through to the degree to which we have to. I'm certainly not anti-chaperone, and I certainly believe that if patients are more comfortable having one present, or if doctors are more comfortable in having one present, or if we all agree that there are certain patients, kids, where certain types of examinations require or ought to expect a chaperone to be present, wonderful. But we've got to lay out the rights of the doctors. We've got to lay out the rights of the institutions. We've got to lay out the rights of the patients. We should agree on who these people are. We should agree on how they're trained. We've got some work ahead of us if we're going to have chaperones become a standard part of the medical examination. I'm Art Caplan. I'm at NYU's Division of Medical Ethics. Thanks for watching.